Hello, and welcome back to our channel, where we explore important topics that matter to you and your loved ones. Today, we're diving into a critical subject, the impact of stroke on elderly care. Did you know that stroke is one of the leading causes of long-term disability worldwide? For older adults, a stroke doesn't just alter their lives. It changes the lives of their families and caregivers too. Understanding the consequences of stroke and how to navigate care is crucial for ensuring the best quality of life possible. So whether you're a caregiver, a concerned family member, or just someone who wants to learn more, stick around. We'll unpack how strokes affect the elderly and share tips to make the caregiving journey a little easier. Let's get started. 1. Understanding stroke and its effects on the elderly. It was a 30-foot. A stroke happens when the blood supply to part of the brain is interrupted or reduced, depriving brain cells of oxygen and nutrients. Within minutes, brain cells begin to die, leading to potentially life-changing consequences. While strokes can happen at any age, they are more prevalent among the elderly due to factors like hypertension, diabetes, and other age-related conditions. For seniors, a stroke often leads to physical impairments such as paralysis, speech difficulties, and vision problems. These challenges can make daily tasks like vision problems, eating, or even communicating nearly impossible without assistance. Additionally, cognitive effects, like memory loss or difficulties with problem-solving, can significantly affect an elderly person's independence. 2. Emotional and psychological impact. The emotional toll of a stroke on elderly individuals is immense. Many experience depression, anxiety, or frustration as they come to terms with their limitations. It's not just the physical loss, but also the sense of independence that impacts their mental health. Imagine having to relearn basic tasks like brushing your teeth or using a fork. It's a humbling and often disheartening experience. For caregivers, this emotional strain can be equally challenging. Watching a loved one struggle can lead to feelings of helplessness and guilt. Balancing these emotions while providing care requires patience, empathy, and sometimes professional support. 3. The role of rehabilitation in elderly stroke care. Rehabilitation is a cornerstone of recovery after a stroke, and it's particularly vital for elderly patients. Physical therapy helps restore movement and strength, while occupational therapy focuses on relearning daily activities. Speech therapy is essential for those who experience language and communication difficulties. However, rehabilitation for older adults often progresses more slowly due to pre-existing health conditions. Caregivers must maintain realistic expectations and celebrate small milestones, like the ability to take a few steps or communicate a basic need. These achievements, though seemingly minor, represent significant progress in the recovery journey. 4. Adapting the home environment. After a stroke, the home environment often needs modifications to ensure safety and accessibility. Simple changes like installing grab bars in bathrooms, using non-slip mats, and removing tripping hazards can make a big difference. For those with severe mobility issues, larger adjustments, like stairlifts or wheelchair ramps, may be necessary. Creating a supportive environment also involves establishing a daily routine. Predictability can reduce stress for elderly stroke survivors and help them regain confidence in managing their day-to-day lives. 5. The role of caregivers and support systems. Caregiving for a stroke survivor is no small feat. Family members often step into this role, providing physical assistance, emotional support, and even medical care. It can be overwhelming, especially if the caregiver is also managing their own career or family responsibilities. This is where building a support system becomes essential. Professional caregivers, support groups, and community resources can all play a role in sharing the load. Many organizations offer stroke-specific resources, from educational materials to respite care services, designed to help caregivers maintain their well-being while supporting their loved one. 6. Preventing a recurrence. One of the most critical aspects of post-stroke care is preventing another stroke. For elderly individuals, this often involves lifestyle changes like adopting a heart-healthy diet, quitting smoking, and engaging in light physical activity as recommended by their doctor. Managing underlying conditions such as high blood pressure, diabetes, and cholesterol is equally important. Caregivers play a vital role here too, by helping their loved ones stick to prescribed medication regimens, attend follow-up appointments, and stay on track with lifestyle adjustments. These proactive steps not only reduce the risk of a second stroke, but also improve overall health and well-being. Thank you for taking the time to learn about how we can improve the quality of life for our elderly. As the national certifying organization for caregivers, the American Caregiver Association is committed to certifying caregivers and providing you with practical advice that can make a positive impact on your life and the lives of those you care about. If you enjoyed this content and found it valuable, please give it a thumbs up and share it with your network. Don't forget to subscribe to our channel for more insightful guides and tips on important topics like this. Thanks for watching.